please request you to join us on stage and give us an opportunity to welcome you as per the Indian traditions. I'd also like to request Mr. Manoj Nair to please join us on stage. A round of applause for Mr. Manoj Nair, Senior Director, Times Strategic Solutions, Times Group, to please join us on stage. And may I request our wonderful team to please bring out the Indian traditional shawl and the idol of a Buddha, as we wish ma'am the very best for every endeavor and every initiative that she takes care of. May I request all of you to please put your hands together. We'll be happy to help you with the same. Ma'am, we'll pack it and send it. Thank you, Ms. Nair. At this point, ma'am, we are humbled by your very kind presence. Our doctors, who we celebrate not just on this one particular day, but every day of our lives, would truly feel that they are being heard and listened to. So may I request you to please address our August gathering. A round of applause, please.
Ms. Sunita Quadros, Chief Operating Officer, Times Strategic Solutions Limited, Times Group. Shri Manoj Nair, Senior Director, ETH. And all the distinguished members of the medical fraternity here today, all the eminent guests, ladies and gentlemen. It's an immense honor for me to be here today amongst you all for the 8th edition of Doctors' Day Conclave, hosted by Times Now. And it's a platform that not just celebrates doctors, but the very ethos of service, of healing, of dedication to this noble profession. So before I move on to anything else, I would like to extend my warmest greetings to all the doctors who are present here. A very happy Doctors' Day to all the doctors, near and far. Thank you for carrying humanity and dedicating your lives to this very noble profession. And we are all grateful for all you do. Your care, your expertise, everything is very sincerely appreciated. I'm thankful to ETH, Times Now, for inviting me here and giving me an opportunity to share with you how we want to take this country forward as we complete 100 years of our independence, particularly in the healthcare sector. I'm part of a government which is in its 3rd tenure now, led by a visionary leader like Prime Minister Narendra Modi ji. And there is immense work that we have done over the course of these 11 years in the healthcare sector. And India's healthcare sector, it won't be an exaggeration if I say that we have scripted a transformative journey. Why I say this is because we have a commitment for 2047 to create a healthcare sector which is resilient, which is inclusive, and which is technology-driven. And we've been taking continuous steps to fulfill this vision for 2047. As India completes 100 years of its independence, we want to present before the country a completely transformed healthcare landscape. We want to ensure access to quality and affordable healthcare to all our citizens. And to this objective, when our government took over in 2014, we started working upon creating a new national health policy. And the national health policy, which was rolled out in 2017, it's a policy which is aimed towards universal health coverage. This new national health policy that we rolled out in 2017 differs from the earlier national health policies. So for decades, we have been continuing with the old health policies which only focused on disease control and curative aspects of healthcare. But in the new health policy, we have tried to make a complete paradigm shift. And today, the new health policy, which we have in India, encompasses all aspects of healthcare. It adopts a comprehensive model, an integrated model, so which talks of preventive, curative, promotive, rehabilitative, and palliative aspects of healthcare. So it's much broader in its scope. And we are being guided by this new national health policy today. And as I said before, the focus of the policy is universal health coverage. And universal health coverage is the target that we are actively pursuing. And it has become important not only nationally, but also internationally. And at both levels, it is an ongoing effort. You would agree if I say that universal health coverage is something that requires continuous efforts. And universal health coverage requires several factors to be taken care of. And the most important of it is a strong political commitment, which we have in India today. My government is committed to universal health coverage. And apart from a strong political commitment, universal health coverage needs strengthening of the healthcare infrastructure, which we are doing right from primary to secondary to tertiary. What we also need is to address the social determinants of health. And we have different schemes of Government of India from the other ministries which are taking care of the social determinants of health. So whether it is giving housing to the poor or giving access to clean drinking water, sanitation, hygiene, constructing toilets, clean cooking fuel, all these are social determinants of health that we are taking care of. Another factor that is very important for universal health coverage is financial protection. And I'll be talking to you about schemes that are today giving that financial protection to the common citizen of India. And the last and the most important is equity and inclusivity, which is the governance mantra of NDA government led by Prime Minister Narendra Modi ji. So that's how we are moving today. And we want to strengthen the entire hierarchy of healthcare, primary, secondary, tertiary. And when I say primary healthcare, we have the presence of 177,000 Ayushman Arogya Mandirs in the country. And today, these Ayushman Arogya Mandirs are revolutionizing primary healthcare. Because earlier, these health facilities would only provide maternal and child health care services to the ordinary citizens who reside in the remote areas. But today, these Ayushman Arogya Mandirs have been transformed completely and they offer a package of 12 services. So it is not just maternal and child health care, it is care for the non-communicable diseases, it is mental health, oral health care, ENT, eye care, first level trauma and emergency care, teleconsultation services, everything is being offered at the Ayushman Arogya Mandirs. And in India today we say that the future of health is preventive. So what is the role that the Ayushman Arogya Mandirs are playing towards preventive healthcare? That's very important for you to understand. The burden of non-communicable diseases is rising. And I'm very proud to say that Ayushman Arogya Mandir, which cater to the grassroots population, today, recognizing the growing burden of the NCDs, these primary healthcare facilities offer screening services for individuals who are aged 30 or above. So for diabetes, for hypertension, and for 3 types of common cancers, oral, breast, and cervix. We're doing screening at the Ayushman Arogya Mandirs, and that is a very important step towards preventive health care because they're helping us in early detection, treatment, and management of these diseases. Similarly, in India, when we advance the philosophy of preventive health care, my ministry, the Food Safety and Standards Authority of India, is running a huge campaign, Eat Right India. And Eat Right India is all about urging our citizens, educating them to adopt healthy lifestyle, eat safe, eat healthy, and eat sustainable. It's important that people make changes in their lifestyle because it is creating a huge burden of NCDs. What we eat has to be nutritious for the body. What we eat must be safe for the body. What we eat should be sustainable also. So it is not just about promoting individual health and well-being, but also about protecting our environment. And under Eat Right India, we have the broader message, which is going under आज से थोड़ा कम, आज से थोड़ा तेल कम, आज से थोड़ा चीनी कम, आज से थोड़ा नमक कम. So under this campaign, we are urging our citizens to reduce the intake of fat, salt, and sugar in their diet. And you all know how obesity has become a big public health challenge, not just in India, but worldwide. And recognizing the urgency of obesity, Prime Minister Narendra Modi ji, in his recent Mann Ki Baat episode, he addressed the nation and he gave a clarion call to combat obesity with collective action. Today, our National Family Health Survey 5 says that 23% of men in India and 24% of women in India are in the grip of obesity. And by the time we reach 2050, there will be 44 crore people in India who will be in the grip of obesity. So this is the time to act. And the time to act is now. And how are the Ayushman Arogya Mandirs playing a role when it comes to educating the community, raising their awareness about what is a healthy lifestyle? These primary healthcare facilities today are generating awareness among the ordinary citizens, telling them what is nutrition, what is the importance of hygiene. They're holding yoga and wellness sessions, telling them how to make lifestyle modifications so that we have a healthier India. And we march fast towards preventive health. So that is how we are strengthening primary health care. And it's also important in India when we envision how India would be, how India's health would be when we complete 100 years of our independence, that the out-of-pocket expenses must go down. And in 11 years of our government, as a share of the total health expenditure, the public health spending has gone up. So 11 years back, it used to be 29%. Today, it is 48%. Which means now people have to spend less from their own pockets. Out-of-pocket expenses are going down because we have taken several transformative steps and come up with schemes like, say, the biggest scheme, the flagship initiative of Government of India, which is Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, the biggest health assurance scheme, which is providing a 5 lakh rupee health assurance to not just the bottom 40% population, which is the poorest, the most disadvantaged, but also now to our frontline health workers, to our senior citizens who are age 70 or above, and also 1 crore gig workers in the country. We came up with schemes like Pradhan Mantri Jan Aushadhi Pariyojana, Amrit Pharmacy, free drugs and diagnostics, and also Pradhan Mantri National Dialysis Program. These are the series of initiatives which have contributed to bringing down the out-of-pocket expenses from 63% 11 years back to 39% now. And what is the impact of this? When out-of-pocket expenses are going down, which means citizens of India, particularly those who are poor, who are from the disadvantaged sections of the society, they seek medical help when it is required without worrying about the financial expenses. They do not delay treatments, so the severity of the illness is reduced and the burden on the facilities, health facilities, also comes down. That is the advantage of bringing down the out-of-pocket expenses. And that's how we are moving. We launched the Prime Minister Health Infrastructure Mission. Why? To fill up the critical gaps which exist in our secondary and tertiary level healthcare. Because we've been through COVID-19 and we've learned some very important lessons that we need to prepare our health infrastructure to be able to respond effectively to any future health crisis, emergency, or a pandemic. And that needs fixing the gaps wherever they exist. So a huge investment is being made today under Health Infrastructure Mission to fill up those gaps, upgrade our diagnostic and pathological facilities, to promote and advance research, and integrate it with the frontline healthcare delivery. And another very important milestone in this direction, that is to prepare our healthcare ecosystem to respond to the emergencies effectively in future, is the National One Health Mission. So today, animal health, human health, and environmental health, everything is being integrated so that we are able to respond effectively to pandemics or any current crisis. And when I say National One Health Mission, it is about embracing an approach which makes a shift from a reactive response to a proactive preparedness. So that is the kind of momentum we are trying to create. We also want to ensure that when we complete 100 years of our independence, there are enough doctors and particularly specialist doctors in the country, and which is why there has been a huge scaling up of medical education infrastructure in the country. I very proudly say that my government has been able to enhance the number of medical colleges in the country by 101%. In just 11 years, we have been able to create 157 new medical colleges. While we were standing at 387 medical colleges in 2014, today we have 780 medical colleges in the country. The new ones which have been created over a period of 11 years. So more doctors, more specialist doctors. That is how India at 2047 is going to be. Because today if you go to the hard-to-reach areas, today if you go to the rural areas, there's still the issue of availability of sufficient number of doctors and especially the specialists. So we have to start somewhere. We don't want to see that happening in 2047, and that is why we've already started taking the right kind of steps so that doctor-population ratio no longer remains an issue of discussion when we complete 100 years of our independence. So that is how we are working towards creating a healthier and a stronger India. My dear friends, Only a Swasth Bharat can be a Viksit Bharat. But then government cannot do this alone. It is a shared mission. It is a common goal. And everybody has to come together. So whether it is media, whether it is the union government, whether it is the state governments, whether it is the medical fraternity, everybody needs to come together. We are today trying to make ambitious strides towards changing the healthcare scenario. And doctors are at the heart of it. You're not just practitioners of medicines, but you're partners in policy making. You're going to be the ones who will adopt the innovative models of healthcare. You're the ones who will play an important role in mobilizing the community. So I'm here to appeal to you for that partnership. Because a healthy India, once again I repeat, is the objective of all. And each one of us must contribute towards building a healthy India. So with this, I congratulate you once again. I thank you all. We all really salute the tireless efforts that our medical fraternity, our doctors make in saving lives. And we will always be grateful, and we want our doctors to keep contributing towards building a healthier nation. Thank you very much. Jai Hind.